My name is Zelina Chinwa. I'm a student at Southern University majoring in social work. I'll be doing a presentation on PrEP, and we will begin. The name of this presentation is PrEP, Your Life Matters. So before we even get into actually talking about what is PrEP, we're going to just do some basic information. I'll give you some basic information as to what HIV and AIDS is. HIV, human immunodeficiency virus, I'm sorry about that. It's basically the virus that attacks the body's immune system. It also affects the actual white blood cells in the body. AIDS, acquired immune deficiency syndrome. This is the actual syndrome that's acquired that affects the CD4 cell count. In particular, a lot of individuals think that you get AIDS first. No, it's the HIV virus, and then as it progresses, it turns into AIDS. Okay. So over time, the individual CD4 count, if they don't take proper measures, they can develop an opportunistic infection or an AIDS-related cancer. So a lot of individuals feel as if that they die from AIDS, but it's actually the complication of AIDS that kills the individual or causes the death. So ways HIV can be contracted. Despite the many myths that are out in the actual world, the only ways that you can contract this actual virus is through blood, semen, pre-semen fluid, rectal fluids, breast milk, and vaginal fluids. Okay, so let's talk about the HIV and AIDS statistics globally and how they've affected our world today. It says in 2012, an estimated 1,218,400 people in the U.S. were living with HIV. An estimated 12.5 did not know their status. So that may appear as a low number, but it's still a large enough number as to the HIV transmission rates continuing to go increase in our society today. Another one that I want to look at is in 2014, Louisiana ranked as the second highest state in estimated HIV diagnosis. And it breaks it down per capita, 30.4 per 100% population. Also in 2014, the Baton Rouge Metropolitan Statistical Area ranked 1 in HIV cases in the U.S. So that right there, that figure is very alarming because Baton Rouge, out of the whole United States, ranked number 1. And this is the state that we live in, the city that we live in. So taking it on a more local level so everybody can clearly understand this epidemic and how it's affecting our community, it said Louisiana, 75% of new HIV cases, 71 of new AIDS cases, and 68 of the early syphilis diagnoses were among men. So particularly looking at this chart, the main population or the high-risk population for the Louisiana area or overall area is men who sleep with men. It says the primary risk factor for new HIV diagnosis in Louisiana is MSM, also known as men who have sex with other men. As of June 30th, 2016, 55% of all people living with HIV infection in Louisiana were MSM. So that's saying that we have a chronic problem with the high rates of infection of this particular population. Sadly, some of the factors that have attributed to this epidemic. So a lot of people probably wonder why are the numbers so high or why they constantly increasing. Some of those can be attributed to the lack of knowledge. A lot of the times individuals don't have the knowledge base regarding HIV and AIDS. They simply don't have the knowledge and they engage in risky sexual behaviors. Also, they have multiple partners, and they're not aware of their partner's status. So all of those contributions play into the increasing number of HIV rates in Louisiana. Also, engaging in sex with partners and not using protection. You know, that's kind of the biggest one that we see, having sex with no condoms. Okay, so here's the great part of this presentation is PrEP, and this is actually how one of the pills looks like that you take. And what it is PrEP is an effective prevention strategy for reducing HIV risk by 90 to 95%. I think that's an amazing number, you guys. And how I get this slide is there's a new thing on the block. This particular drug or this particular strategy was designed for people who fall into the high-risk categories, which is men who have sex with men, MSM, individuals who use drugs, who inject drugs into IDUs, transgender men and women, and heterosexual adults who are at high risk for HIV infection. So that's what the actual pill, that's the population that they determine are high risk. And the great thing about PrEP, and I think this is so fascinating, is that PrEP is a single pill that is taken once daily to prevent HIV. Okay. So looking at this particular slide, and the reason why I chose this picture is because it puts people in a cross of what should they do. We had to have a condom on one end and we have the pill on the other. A lot of studies went against PrEP, and they stated that, well, if individuals just use PrEP is only going to decrease proper ways to prevent HIV. So in combination of other preventative measures, studies have shown that if individuals take PrEP, also attend HIV educational classes, learn how to properly use a condom. I know that sounds so elementary, but a lot of times individuals don't know how to properly use condoms. So we teach them how to properly use condoms, active HIV testing where they're aware of their HIV status, and also daily use of PrEP. This will drastically decrease the rate of contracting the HIV virus. One of the statistics that stood out to me the most was this one. It says, if 20% of the MSM population in the United States actively use PrEP on a consistent basis, the chances of 60,000 new HIV transmissions could possibly prevented within the next 20 years. That's an amazing number, you guys. With this one pill, that this number here can be used, can possibly be prevented within the next 20 years. Okay, so now we'll watch a brief video on PrEP in more detail and how to access it through local health providers.
HIV and having safe and healthy relationships are an important part of sexual health. Preventing HIV and having safe and healthy relationships are an important part of sexual health.
We'll take you through an overview of PrEP with PrEP 101, show you how to access PrEP, and let you find out if PrEP is right for you. PrEP is an HIV prevention option that works by taking one pill every day. PrEP stands for pre-exposure prophylaxis. When taken every day, PrEP can provide a high level of protection against HIV and is even more effective when it is combined with condoms and other prevention tools. People who use PrEP should take the medicine every day and return to their healthcare provider every 3 months for follow-up and prescription refills. Now, let's take a look at the numbers. In several studies of PrEP, the risk of getting HIV infection was up to 92% lower for those who took the medicines consistently than for those who didn't take the pill. Some people in clinical studies of PrEP had early side effects such as upset stomach, loss of appetite, or mild headache, but these were all mild and usually went away in the first month. How do you start PrEP? Talk with your doctor or healthcare provider. If you and your provider agree that PrEP might help, get tested for HIV and other sexually transmitted diseases, and to see if your kidneys are working well. If PrEP is a good option for you, your provider will give you a prescription. PrEP is covered by most insurance programs. If you don't have insurance, your healthcare provider can direct you to medication assistance programs that may help pay for PrEP. You can also contact your local health department and HIV and AIDS service organizations for more information. Thinking about PrEP to prevent HIV? Here's what to do next. Make a list of why you think PrEP would be right for you, and do your research and seek out information to help you decide. Also, think about your routine and what might make it easy or hard to take a daily pill. And always know you can call your healthcare provider if you have more questions. But what are the best questions to ask? Would PrEP be a good option for me? How much would PrEP lower my risk of HIV infection? What else can I do to lower my risk of HIV infection? Can I get help paying for PrEP? Are there any side effects to PrEP? How often will I be tested for HIV and other STDs? Will you prescribe and manage PrEP for me? If you decide PrEP is right for you, definitely take your pill every day. Follow your healthcare provider's advice about how to take your pill. This will give it the best chance to prevent HIV infection. Tell your healthcare provider if you have trouble remembering to take your pill or want to stop PrEP. Remember, you are in control. Get informed. Make the right choice for you. Check out the Start Talking Stop HIV website for resources.
So that was a video explaining how to access PrEP, some of the questions that you may want to ask yourself, or if you know anyone that may be interested in PrEP. I feel as if that is a great intervention, especially in this century where HIV and the AIDS virus is on as an epidemic. And the last slide I have here says, with this intervention, this exciting new prevention, this can possibly change the lives of individuals one treatment at a time. This concludes our presentation, and if you have any questions, let me know at the end.